All right, so Taylor, whenever you're ready, you can take it away. Oh, do I need to
Perfect.
switch
Thanks.
things again?
Yeah, it's still sort of showing that side view.
Here we go. Just thinking. Is
Perfect.
that
That
better?
looks great.
Oh,
Yep.
although it went too far.
That's okay. So, like Barbara said, welcome to week 9 of our 7 Habits of Long-Term Care programming. We've been discussing in weeks past about the progress notes and research and goal writing, and now we're going to be discussing our treatment encounter notes, right? So this is really sort of getting down to the our basic day-to-day quality documentation. Go ahead, next slide. So if you've been following along on this checklist, these are sort of the main key points that we want to really focus on when we're looking at our treatment encounter notes. Do the interventions that are being provided for the session relate to the plan of care and the goals? Oftentimes, we've been seeing treatment encounter notes that are really well written, but it's not related to the goal and the plan of care. And I always like to remind my therapist to use that tab function in your daily note that you can just tab over to the goals and make sure, refresh what the goals are, if there have been any new ones added to make sure it's aligned with what our treatment note is looking like for that day. Next, we're looking at, what intervention or activity are you choosing and why did you choose it? What's the actual skill for the therapy service being provided, right? Was there anything that's being assessed or monitored, and why is this important in relation to the complexity of the patient? You can always bring in their diagnoses and sort of their fluctuation with different patterns that might support the justification. Also, was there anything that needs or needed to be changed during the treatment and why it was changed? Did you do any specialized therapy techniques, such as specific types of manual therapy or modalities, and why did you use them? As well as, were there any specific cues that you used, and how were they new or different from previous treatment sessions, right? Was it a reduction in cues needed to perform the task, or did they need more because of a new onset of new symptoms from a UTI or something like that? And then also, was there any new patient or staff education provided, right? As we've learned through this last year, really including the staff documentation that we're providing for a case as we're, going through our plan of care and before discharge is super important to strengthen the reason for skilled services. And then that last big bullet point, what was the result of the services provided? This is a response to treatment. So what happened because the treatment provided? Were there changes during the session that were implemented? What was assessed and monitored, and how did you provide those differentiating, level of assistance? Next slide, please. So here I have linked the treatment encounter note post-stet. Always refer back to the post-stet because it has a lot of great information. But anytime a narrative TENS note is documented, we need to make sure it's capturing the information that supports the need for therapy, right? The skilled interventions, the patient response, the changes and adjustments to treatment based on the patient's condition, as well as any changes in the patient's function that we might see, even if that's a decline. And then also data from any vital signs that we're monitoring and standardized tests. This is also super important, especially for our PTAs and CODAs, right? As now you cannot get into those progress notes and research anymore. This is where that objective data really needs to be put so that when the evaluators are doing a progress note or research, they can refer back to your treatment encounter note and get that information to put in that UPOC. Also, real quick, I just wanted to touch on group services, right? You need to make sure you're including the ratio of the therapist to patients you have in that group, as well as the rationale for the purpose of group on that date, and make sure it's in relation to the goals that they have in their plan of care. All right, next slide. Now, how can we strengthen our TENS notes, right? Documenting your clinical services provided in addition to any other relevant patient information. That can include patient self-reports, any sort of adverse reaction to the intervention, as well as communication and consultation with other providers, not only other therapists, but the nursing staff and the supervising clinicians. Also documenting any significant or unexpected changes in the clinical status. And if it is such a significant change, would this justify an updated plan of care? So if you are an assistant, in a treatment time and there has been an unexpected change, communicating with that evaluating therapist to see if the UPOC is justifiable. Also documenting the equipment that was provided and any education and sort of the follow through on how that carryover went, as well as any additional information that the qualified professional finds appropriate. Also, I cannot say this enough, but do not copy and paste those notes. It's nice sort of having good verbiage and a framework that you can use for different scenarios, but a copy and paste verbiage for day to day is not skilled, right? As well as using that build function in the tens. It's not patient centered. It's not specific to what's happening. And it really truly doesn't take, it doesn't paint the picture of what's really happening in your day-to-day sessions. And it truly takes away from the skilled services we are providing. Next. So let's talk quickly about the modalities in our treatment notes. We know modalities are very skilled service, and there is a post-it just on modalities, and I recommend looking at that. But just briefly, we need to make sure when performing any modalities, we need to document the rationale for use as well as the parameters of that said modality, and then specify the area being treated and the amount of time it's being applied. Also document any objective measures in relation to that specific modality, and then subjective results, right? Any pain, how was the pain pre and post, as well as skin checks, right? Skin checks pre and post, and if it did have any effect on function after the modality was provided. We also need to make sure that there's a clear differentiation of versus unskilled activities to support all those minutes logged, during that modality. So oftentimes, with heat, if we're providing a heat pad, that can't solely be billed by itself, but what else are we doing with that being provided to help, manage pain in order to perform, further activities, etc. And next. Now, the response to treatment. This section I feel is often underutilized, and we really need to make sure that response to treatment section documents how the activity yielded good results and what that means for the patient and ongoing therapy activity, right? It needs to discuss the impact of patient's medical condition on the session and how risk factors are being managed throughout, day to day, as well as how objective data relates to ongoing progress and if there is a need for change in interventions and how that relates to the justification for ongoing skilled services in that plan of care. Next. Now, a few tips to leave you guys with just to sort of summarize all of this up. Please make sure you're documenting the need for the individualized skilled intervention with including different functional levels, the specific ambulation distances, exercise, including reps, and being able to differentiate how those reps were increased, or maybe they weren't able to perform as many reps that day because of whatever is going on clinically, and report and avoid the repetitive documentation from day to day. Tip number two, really document what is being assessed and the decisions and changes you've made as a result of those assessments, right? Are you upgrading or downgrading the task based off of, their O2 level being lower that morning, or how did you sort of modify the environment to make them more successful during that intervention? Tip number three, make sure you're documenting the purpose of the equipment and the need of a skills therapist versus using a brand name or a program, right? Oftentimes we'll see somebody, you know, performed a new step for 20 minutes, but what about that is skilled? Are you assessing their postural alignment? Are you monitoring their vitals throughout? Use, don't use the actual new step verbiage in your treatment note. Discuss what you're actually doing as the skills of a therapist. And then lastly, document the details with the response to treatment, right? Their ability to tolerate more challenge, maybe a report and reduction of pain after a modality, or maybe the need for increased monitoring of vitals. So, taking all of this, hopefully it can sort of help you sort of reset and really work on those daily notes so that we can strengthen that documentation, which then leads over to stronger documentation on our UPOCs. And, hopefully this will be successful for you guys. But we'll take a second now to pause. And if you guys have any questions, please feel free.